whole of the cancer pathway, those times when you're waiting with so much uncertainty are perhaps the most difficult, because that sense of not knowing and feeling that it's all a bit out of your control, I think as human beings, that's really hard for us to manage. And I think often those times can come and go. I think often we're first confronted it when there's a possible diagnosis and investigations, and there's this terrible time of just waiting, not knowing, and not really being able to do much more than that. But it can come and go as news might change, or you're waiting to find out the results of a scan or to see how the chemotherapy is working. And I think it's really difficult. It can be associated with lots of anxiety and fear, which can affect you in a very physical way that can be really, heart racing, tension, headaches, all those sorts of things, which can be exhausting. But it can also bring up memories of other difficult times in your life where it might have felt very traumatic or sad or difficult. So I just think it can be a complete emotional roller coaster at those times. And then, often that can feel quite out of character and can feel quite scary that you're responding in a way that isn't really you. But actually, it's really common to feel those sorts of things. And I think as a human experience, the waiting with uncertainty and not feeling in control is the hardest part.
The main ones we find people experience are fear and anxiety. They're very anxious and very scared about what they're going through and what's happening to them. Some people feel very sad. Obviously, shock is a factor. If you've had news that's prompted you to feel very uncertain about your future and what's going on at the moment. And at that point, we would really encourage you to go back to your healthcare team and ask those questions. And don't feel you're making a pest of yourself, because that's what they're there for, to just really go and say, I don't understand this. I'm feeling very anxious, very scared. It's okay to say that, to show your vulnerability and show them that you're struggling. And that's what they're there for. So I would really encourage you to just get that support from the professionals that know your case and not increase your anxiety and uncertainty anymore by looking up things on the internet that aren't maybe real. So it's really important that patients know what support is available and where they can get help. That's really important. At that first meeting, when they're given news or at any point along their pathway, they're told where there's support. Sometimes patients are told where they can get support at the beginning and it doesn't go in, they don't hear what's being said. So it's really important that's reiterated at lots of points along the way so they know. The first thing I would say is sometimes there's support nearer to home than you'd think. To think of your friends and family and people that are there for you, and just pick those people that are really supportive, because we've always all got people in our lives who aren't very helpful. So be a little bit selective of those family and friends who are there for you, that it's okay to say I'm struggling today, or I need a bit of help, or I don't want to talk about it today. So first of all, we would say friends and family. Don't be frightened to say I need a bit of support. The other thing is your healthcare team. They're going to be absolutely crucial to you through this whole experience. It's really important you develop a good relationship with your CNS and your doctors, physios, allied health professionals, anyone in your healthcare team that can help you with and support you with what you're struggling with.
One of the things as psychological professionals we all have in mind throughout the cancer pathway is the idea that the key thing that people need to learn to do over that time is to adjust, that it is such a process of change, going through a cancer diagnosis and then the whole enormous treatment pathway can be really life-changing. Everything about your life is thrown up in the air. Your future, your family relationships, your work, how you can manage at home, everything feels different. Your finances, everything feels different. And from that word go, it's just one change after another. And when there's points of change, really acute change, clear change along that pathway, that can feel very overwhelming, but things do settle. Give it a few weeks and things might feel very, very differently, and you'll be surprised how much time will help you to adjust, but that you also will have coping strategies that you may never have thought of as coping, that will come into play and help you to settle. And learning a little bit more information will bring your anxiety down a little bit and things will change. That's not to say there won't be lots of ups and downs on that pathway, but I think change is one thing that you can almost guarantee, and finding ways to adjust and knowing that it will take time and it is really difficult, and it's fine to find that process a challenging one, perhaps can help to reassure you that sometimes it's just getting through.